Thank you for joining. For the sake of time, I will not spend too much time on the introduction, but I think as this is a country meeting, it's good to give some background. So I will give a little bit more information about the board and what our plans are for the coming days. So I think it's nice to know that our initiative is based on the Viral Hepatitis Prevention Board, which is something that we're organizing for more than 20 years. It's existing more than 25 years and is kind of similar as with what we are doing now for HPV prevention and control. So it's the same Secretariat. And just for your information, with that board, we had a meeting here 17 years ago in 2004 on prevention and control of viral hepatitis in France, lessons learned and the way forward. If you want to see what's discussed, you can look at the website on the viral hepatitis issue of 2005, where everything is nicely described, and a number of people, you can have also the participants list, or were approached or are joining us today. So, but let's talk about HPV Prevention and Control Board. The aim is really to generate, multiply, and disseminate relevant information on HPV to a broad area of stakeholders, and thereby contributing to the control of HPV infection and to the prevention and screening of HPV-related cancers. So we want to provide evidence-based guidance on key technical and strategical issues, and we also want to contribute to monitor the progress of HPV control programs at country and regional levels. I think the key of our board are really our prominent experts or advisors. Most of them you have seen at the introduction. They act in their personal capacity. They are often affiliated with stakeholding partners. We try to have open and honest discussions, and I think they're all doing this on a voluntary basis. I think it's a win-win. Everybody is aiming at the same goal, which is prevention and control of HPV related disease and infection. And we are quite informal as an organization, so we have a minimal bureaucratic structure. I'm not going into the list of our advisors. I think all the names were mentioned. I think important to know is we also have observers from major institutes as IARC, WHO, and CDC and ECDC. So this is the Secretariat. We are a small group based at the University of Antwerp, where we use the facilities. And we prepare and organize these meetings. We make sure that the output is made available to a wider audience. We have a website where all the meetings can be consulted, and if speakers agree, also the presentations. We also try to be present in third-party meetings. I think important to know is for our activities, we do get money from industry, but all financial issues are done according to the rules of the University of Antwerp. And we do invite these sponsors to be an observer at our meetings. This is the website, which was recently adapted to be smartphone friendly. I don't like the new layout, but I think all the information is there and you're free to access it. Just a little bit on the history of our board, and I think yesterday we should have celebrated our 6th birthday because we had our kickoff meeting the 1st of December in Antwerp, and you can see already a number of usual suspects. Emily was there, Sylvia was there, Mark Arben, Mark Kane, Mira, Xavier Bosch, Margaret Stanley, and there is Mario also present already at that kickoff meeting. Our first big meeting was on barriers in HPV vaccination and cervical cancer screening in June in Antwerp. Subsequently, we went to Denmark, where there was a vaccination crisis, and at the headquarters of WHO Euro, we had this meeting to discuss these issues. Subsequently, we had a technical meeting on building trust and managing risks together with the London School of Hygiene and Tropical Medicine. And there also you see Eduardo looking at the camera, very interested. Subsequently, we went to Ireland and the UK to have a country meeting on that topic, and we were welcomed by the Minister of Health in Ireland at that moment. Then we went to Romania to look at, and it was also a technical meeting on the role of healthcare workers in HPV vaccination and screening, but we also had half a day to discuss issues in Romania regarding HPV vaccination. And then together with Nubia, we organized a country meeting in Colombia, in 2018, which was also quite successful. Subsequently, we had a number of, first we had a meeting on vaccination of adults in November, and then we had 3 online meetings discussing the challenges in HPV screening, triage of screening positive samples, and screening in the area of vaccination. We also discussed, and I don't know, we discussed also the impact of COVID-19 on screening and vaccination programs in November last year, and beginning this year, we discussed reinforcing access of HPV vaccination and cervical cancer screening and treatment. This was in April 2001, so earlier this year. On our website, you can find short videos, and the idea is also that we will approach a number of people during this meeting to extend our number of interviews and videos. We also, as I mentioned, have the presentations as videos available on our website, which I think is very useful. And as I said, we also try to make the things we discuss available to a wider audience. So we try to have peer-reviewed publications in peer-reviewed journals. So here you see a number of our meetings that have been published recently. I think BMC Proceedings is a good way to, especially for meetings, is a way to make these meetings available to a wider audience. I think also for those who haven't noticed, especially NIAP did a lot of effort to make the background document of this meeting. So we did a literature search, and we selected about 75 abstracts regarding research and studies that have been performed in France. And I think it's a good background document to help us with the discussions during this meeting. I do want to share a number of challenges we have on HPV vaccination, and definitely we also have them on screening, and we will discuss them in the meeting. But if you look to HPV vaccination programs, you see a limited number of countries that are doing well, achieving already the elimination goal of 90% coverage. And I specifically took the data of Flanders, which is not always available, but in Flanders we are also achieving the goals. But then we see a number of countries where there was a dip, and as I mentioned, there were 2 countries where there was a vaccine crisis with a serious dip on coverage, Ireland and Denmark. These countries are recovering, but are still far from the target. And then you have countries where things are, I would even say, linger on. They are between 50 and 60 or 70% of coverage, but they are not improving over the years. I think if we look, and this is a publication by Paolo Bonanni, looking at the WHO European region, only 10 countries had a vaccine coverage target put for HPV vaccination. And if you look to the target that was set, that there are only 4 of those 10 that are really aiming for the 90% target. So there's a lot of things that still need to be done. And this is a new tool from WHO, and I think Hero could put the link in the chat if possible. But this is a very nice tool. You have global map area where you can see the whole situation in the world, but I think it definitely helps us to monitor how countries are doing towards the elimination goals. And here you see the data of France. I think there's a lot of things we can discuss, but you see that the last reported coverage was 33% for full HPV vaccination of girls in France. So let's just briefly say the meeting objectives. So we want to discuss the healthcare system and prevention and control measures in France, review how prevention and control programs are organized within the French healthcare system, provide a summary of the epidemiology, burden of disease, and surveillance related to HPV and HPV-related cancers in France, look at cervical cancer screening and treatment, so give an overview of the current control measures, discuss successes, topical issues and challenges related to screening and treatment, and also review the possible implementation of alternative screening methods and strategies such as self-sampling. On HPV vaccination, we want to have an overview of the current vaccine program and also look into successes and challenges. I think we will also look at the state of vaccine confidence and associated challenges and possible solutions, and discuss the impact of HPV, of the COVID-19 pandemic on these topics. As you will see on the program, we have organized a number of breakout groups, one this afternoon and also tomorrow. So I also invite all participants to participate as much as possible in these discussions. Thank you very much, and with pleasure I hand over now the floor to the chairs of the first session.